Tensions are rising across the country as immigration enforcement activity intensifies ahead of major events like the Super Bowl. There have also been protests overseas, including in Milan during the Winter Olympics, where some demonstrators claimed U.S. immigration agents were involved in security efforts. Officials have pushed back on that claim, saying personnel on the ground were from DHS security divisions, but skepticism remains among critics. Back in the United States, several incidents involving ICE, Border Patrol, and other federal agents have sparked outrage. In Memphis, videos circulated showing U.S. Marshals executing a DOJ operation during which a dog was kicked amid the chaos. The footage quickly fueled anger online, with critics questioning the conduct and professionalism of the agents involved. In Minneapolis, enforcement operations have also drawn controversy. Independent journalists captured scenes of armed agents confronting individuals during a stop. Officers were seen instructing bystanders to step back while checking identification.
Hands on your face! Hands on your face!
Get out!
Hey, I need you to back up. You need to back up. Stay safe.
They're pointing handguns at the drivers in the vehicle right now.
No.
Hey, get back. You guys need to stay back. You can record, but you gotta be back.
Step on the car.
Get out.
Hey, open your fucking door.
I need you to back up a little bit more. Hey, get back.
Hey, get the fuck back.
Back. You need to get back. Hey, no,
That's the same agent from yesterday.
Stay
That's
back
just,
over here.
Step back. I know.
You guys can take pictures, you just need to stay back.
Give me a favor.
I see the press, you're good.
Check him for ID. That's fine.
I see you. Get a little bit closer.
I recognize you. Put your creds down. You're fine. If you got creds, pull them out.
I got you. Thank you.
Legitimate, please. Okay. There's a lot of fake ones out there, so I'm saying it. So you know, these guys were all threatening us yesterday with handguns. So
these people in the car were threatening you with handguns?
Yeah.
handguns, like threatening to shoot
We
us.
know.
So
Oh, you mean like with hand symbols?
pulling them out, trying to engage us.
Pulling out literal guns?
No. Assuming that we were going to do something. So that's why they're being ID'd right now.
Fuck nice. This is wrong.
Were you guys looking for these specific observers from yesterday's events, or did you happen across them today?
Just got lucky. If that's what you want to call it.
Get out of our neighborhood, you human trafficking scum!
Tensions flared as community members accused agents of intimidation tactics. Law enforcement officials claimed they were responding to perceived threats from the prior day, but residents described the atmosphere as aggressive and excessive. In Texas, another viral video showed federal agents entering a home without presenting a warrant, according to the family inside. The confrontation escalated, and one agent appeared to physically shove a person who was recording the encounter. Civil rights advocates argue that these kinds of incidents erode trust and raise serious constitutional concerns.
But no warrant. U.S. citizen and no warrant. Inside my house. They're inside my house. Open the door. Wait, Mom, is that you? Wait, hold on. Where is he? Get out the fucking house. You don't have a fucking warrant. Get out the house. No warrant. You don't need to touch him. Why are you touching him? Why are you touching him?
Papi, este por acá, este por acá.
¿Por qué le estás tocando? Are you good? No. Get out of here. There's people on the window. Look.
Where the fuck is your warrant?
Nobody's here.
Where is your warrant? Where is your warrant? Where the fuck is your warrant? Hurry up! Get the fuck out! Get the fuck out and you broke the window! Get the fuck out and you broke the window! Get the fuck out! Get the fuck out! Where's your warrant? Where is your warrant? Child arrested! Where is your warrant? Hurry the fuck up!
The fuck out of bed. It's not Anthony. It's this other guy that's trying to help. Anthony's right here, but me and Anthony are not getting in this because I don't know. I don't want to have to. Hold on.
I didn't know you were still there. I didn't know you were still there.
Get out of the fucking house! Get out of the fucking house! Get out of the fucking house! Not us! The fuck are you looking for? Fuck out of here! Pussies! We got here and, I don't know how they got it. Fuck guys! I'm recording you. Right there. Get out of your face. Get out of your face. I'm recording. I'm recording a fucking face.
A similar clash unfolded on East Franklin Avenue in Minneapolis, where agents reportedly broke a glass door to access an apartment complex. Residents confronted them, demanding to know whether they had legal authorization. The footage shows frightened tenants questioning their safety while armed officers moved through the building.
Take your mask off.
Yeah, you can't get in here because you don't fucking live here. I'm telling you for myself. How safe do you think I'm fucking gonna feel? How safe am I gonna fucking feel tonight?
We gotta take
I live
pictures.
here. You can't tell me to fucking back up. You could have did it. This is my home. This is what you did. Do you feel safe? Do you feel safe? Yeah, I'm sure. Because you have a fucking gun. Yeah. Yeah.
Fucking guy with a big fucking.
So you didn't read the policy at the front door, right? Oh, and now you're. Yeah. So now anybody can get in. I want you to show that. Yeah.
Yeah, so now they just basically left it open so anybody can walk up in the fucking people's home. Look at that right there. Look at what the fuck they doing.
So if I
Look at what the fuck they doing.
Go home
Look
right
at
now.
what the fuck they
Because
doing.
that's where I fucking live. That's where I fucking live. I can't even get into my own home because of you idiots. You could have fucking gotten a warrant and gone through the fucking front door.
That's what I'm saying. Hampton County's right down the fucking street.
This is my fucking home. This is my fucking home, and this is what you're doing. No, I'm a fucking medical student. I should be studying. I shouldn't be here banging with my goddamn cereal.
Beyond the immediate confrontations, healthcare professionals are raising alarms about the broader consequences. Doctors in Minnesota say fear of immigration enforcement is keeping patients from seeking medical care. According to physicians who spoke publicly, some families are avoiding hospitals altogether, even in serious situations like childbirth complications or treatable conditions in newborn. One case that drew particular attention involved Renee Nicole Good. State Senator Dr. Matt Klein said he learned that she reportedly had a pulse minutes after being shot during an enforcement action, yet medical assistance offered at the scene was not immediately administered. He and dozens of healthcare workers held a press conference expressing concern that law enforcement actions are interfering with emergency medical care.
This morning I learned for the first time through an NPR story that Renee Good still had a pulse 8 minutes after she was shot by an ICE agent. And yet the offer to administer aid from a physician on the scene following his Hippocratic oath was denied. I can't say how much that stirs the blood of everyone behind me here as we try to fulfill our obligation, our oath, and our duty to care for the people in Minnesota. And I believe it stirs the blood of every patriotic Minnesota who knows how we treat each other in this state. So that is what we are here to speak to today as healthcare professionals.
Doctors also report that patients are skipping follow-up appointments, delaying urgent procedures, and avoiding clinics out of fear they could be detained. Healthcare providers say ICE agents have, in some cases, entered hospital areas in ways that disrupt care and intimidate patients.
No, absolutely. We saw it both at the death of Renee Good and also at the death of Alex Preddy. There were providers on scene who were prevented from administering aid. And who knows, in particular with the case of Renee Good, what impact that might have had, since we know she had a pulse several minutes after the shooting. And of course, what also developed out of that press conference, the 50 or so physicians behind me wanted to share their stories that people are terrorized and afraid to come into clinics or into hospitals because they're afraid they'll be snatched. So they're staying home with acute conditions like appendicitis. They are not going to their follow-up neonatal appointments. They're allowing their jaundiced babies to go untreated. And once they get to a hospital or a clinic, ICE is completely buffoonish. They are completely overstepping the boundaries of where they should be in public areas, stepping into private patient rooms, sometimes accosting individuals in the middle of medical care. And I tell you what, I've been a doctor for 35 years. I've worked with law enforcement and never had a problem. There's a clear understanding of how you conduct yourself professionally so that you can perform your duties and not interfere with medical care or patient privacy. And these guys have no concept of that. We heard that from law enforcement more compellingly than my story. We heard from police chiefs who said after a shooting like Renee Good's, the first duty of officers on scene would be to administer immediate aid. Obviously, they watched, as you and I did on the video, that nothing like that occurred for several minutes. And the other aspect of this is that we have this large detention facility here in Minneapolis, the Whipple Detention Facility, and all reports now are that people are being held there with leg shackles, packed into cells. There's no beds, no blankets. There's no sort of healthcare providers on scene to administer medications appropriately or intervene should a medical emergency occur. So it's just primitive. And it's like something out of a 19th century novel, honestly. Yeah, well, the one was a patient who chose to sort of have birth at home rather than come in for an in-hospital birth, and we're able to guide people through that in an emergency over the telephone or something to have a home birth, but it's obviously not ideal, and it wasn't the perfect circumstance for that. A patient who had a baby at home who had jaundice, and didn't want to bring them in for sort of appropriate intervention and monitoring of that condition. So people avoiding really necessary care. And as you know, and as we all know, delayed care is worse care. People come in sicker, their illnesses are more severe, and their cost of care is much higher.
Physicians argue that there are long-established protocols for how law enforcement can operate in medical settings, and that those standards must be respected to protect patient safety and privacy. Dr. Klein, who works in internal medicine and is now running for Congress in Minnesota's 2nd District, says the situation amounts to a public health crisis. He describes detention conditions as overcrowded and lacking adequate medical oversight, raising further concerns about the treatment of detainees. At the political level, the issue has become central to his campaign. He argues that Congress must reassert oversight authority and ensure enforcement agencies operate within constitutional limits. Beyond the legal debate, he also warns of economic consequences, saying aggressive immigration actions could hurt Minnesota's agriculture, healthcare, and service industries by shrinking the workforce. Meanwhile, residents across Minneapolis, St. Paul, and other communities say daily life feels unsettled. While debates rage in Washington, families are grappling with rising costs, healthcare access challenges, and uncertainty about their safety and rights. Supporters of the enforcement actions argue they are necessary for national security and rule of law. Critics contend the methods are heavy-handed and damaging to communities. What's clear is that the issue has become deeply personal for many Americans, and it's not going away anytime soon.